Hello. Hello. Good evening. Hope you've had a couple of good days. I hope you've been at peace and at rest and you've gotten recharged a little bit because, as we know, the fight goes on. Stacy Van Veen says brownies are in the oven. Good evening, peoples. By the way, hi, Matt. Hi, Stephanie. Hi, La. Hi, Dale. Hi, Dolores. Hi, Stacy. Hi, Rick. Evening, all. So much for peeing. I'll share and then pee. Well, thanks. I guess we really had to know that, Rick. Stephanie says sharing, taking little breaks. Well, thank you, Stephanie. Dolores is saying sharing. Teja says my performance is this. After making 20 or so mask prototypes and giving them all away, number one daughter bought me some delicious fat quarters, and I have made 22 masks, almost complete, in the last 3 days. Wow, Stacy, you're doing a lot of work. And Kay says, hi, all. Hi, Kay. Okay, so, of course, we've been the recipient of lots of evaluative comments about how we as a nation are doing from our president. Some people have always declined to call him that, but it doesn't change the fact that he was inaugurated. And that he has been giving orders now for 3.5 years. And we've all suffered from many of the consequences. Rick gives us a piece of wisdom. Sometimes the truth hurts, other times it's funny, sometimes it just is. And then, of course, we have people who come out with editorials every day, and they say that they give a completely different view of the performance of the president and the administration and our nation in handling the coronavirus thus far. So I wanted to present something of my perspective on what is going on with the coronavirus. Well, COVID-19, actually, I should say. I'm going to focus more on COVID-19. It seems that over a period of time, it's become clear that while you can contract the coronavirus by being careless in touching surfaces, by far the major outbreaks of COVID-19 seem to have been due to human spreading, spreading from humans to humans through the air, indoors, in relatively close quarters. And that now is thought to be the primary source of spread. And so community spread is very key in causing COVID 19, lots of cases of COVID 19, lots of deaths from COVID 19. Now, it's quite easy to compare nations. Maybe I shouldn't say it's that easy. It appears to be quite easy to compare nations based on the fatalities that they've had. Okay, easier than comparing them on the basis of the cases they've had, because the case data is so uneven from nation to nation in terms of how it is actually gathered. Even in countries which are relatively sophisticated, like the United States, in terms of data gathering and keeping records, it's also true that it looks like there's substantially an undercount of a number of cases, because we find that in certain institutions, cases have not been carefully counted. And there seems to be an undercount, which is a rather severe undercount here in the United States. And when you look over the international statistics, it's hard to believe the extent to which cases are very, very low in certain countries that commonsensically one is certain cannot have the very low number of cases they have. So it seems like the most reliable of statistics is probably the fatality statistics, even though those represent a severe degree of undercount as well, because there apparently are many people who die at home from COVID 19 and who therefore don't necessarily get counted in terms of their deaths being due to COVID 19. Okay, in some of the developing countries, we would expect that large numbers of people might be dying, okay, at home, and the records just don't get out there, and that there's a severe undercount of not only cases but also fatalities. Uh, so if there's a severe problem in counting the fatalities, there's also a severe problem in counting the recovery cases, and there's also a severe problem in counting the cases that are severe. Now, this is true, of course, also because in many countries the healthcare systems are very underdeveloped, and uh, so we have a situation where people, if they need to, can't even actually go to a hospital or go to a doctor, okay, and be diagnosed. And of course, the level of testing in various nations tends to vary severely based on the resources of those nations and the seriousness with which they took the need for testing as a matter of policy of those particular nations. So we know all that is a problem. Okay, so it seems like the most visible and reliable of the statistics, cross nationally speaking, will be fatalities, even though we know in many areas of the world there's a severe undercount, okay, of those. So let us look for a minute at some of the results with respect to fatalities, and let me share on my screen here. So this is a popular tracker of COVID-19 statistics, where the statistics are gathered each day by screen scraping sites around the world, websites of governments and public institutions, okay, of various kinds. As of now, and this is not complete for today, we'll see the complete statistics tomorrow. But as of the latest count, which was probably sometime this afternoon, this particular site picked up 99,804 fatalities within the United States. And you see 1.7 million confirmed cases in the United States. And you see the ordering here. The ordering is by number of confirmed cases within a particular nation. Brazil is second only to the United States. Russia follows, then Spain. Now, of course, the number of confirmed cases is going to have a lot to do with the population, okay, of nations. And the United States, as you know, has 330 million people. And Brazil is somewhere around 220 now, I think. But let me check on that very briefly. This is the Worldometer, which is a population counter. It puts the population of the United States at 331 million. Brazil is number 6, 212 million, 559,417. Of course, the accuracy of that statistic is not to be trusted. But so you can look at those two things and get a comparison of the number of deaths, but compared to the population. Okay, now Russia has a lot less population, okay, than Brazil right now, since the breakup, okay, of the Soviet Union, and the many deaths in Russia as a result of the introduction of neoliberal capitalism during the early 90s. The population of Russia fell drastically. Okay, a large part of the fall was due to the Soviet Union breaking up, but within the Russian Federation itself, there may have been as many as 30 to 40 million fatalities due to the disruption of the economic system. It was very, very brutal process, with a large number of males committing suicide, either deliberate ways or through excessive consumption of grain alcohol that was very toxic. Anyway, Russia has about 145 million today. Its population has been growing somewhat, not that much, but somewhat since the disaster. When we get to the number 4 countries in cases, though, first I should say, with respect to Russia, we probably have a severe undercount, okay, of cases. With respect to Brazil, we probably have a fair size undercount as well. but probably the count of cases here in the United States, okay, is probably more accurate than it is for Brazil, okay, and for Russia. Now we probably have an undercount here too, because we probably haven't really begun to seriously count the people who are at home with COVID and who were never diagnosed and who were never seen, who were never tested, but who got well. And we'll find out more about that through indirect ways as we in the United States go forward. But we're pretty sure this undercount is a severe undercount, but probably not as severe as the Brazilian undercount, certainly not as severe as the Russian undercount, however. But of course, we should add that both in the Brazilian situation and also the Russian situation, the case count may be subject to manipulation through politics to a greater degree than is the case in the nations just following: Spain with 282,000 cases, the United Kingdom 261,000 cases, Italy 230,000 cases, France 182,000 cases, Germany 180,000 cases, and Turkey and so on. India has only 144,950 cases, and India's population is 1,380,000, 4,385 people. The Indian population is only slightly behind the Chinese population now. And so it has a huge population, and we would expect far more COVID cases than are reported, okay, in India. India is about maybe 5 times to 4.5 times the size of the population of the United States, and has, of course, far fewer cases. 1/15 a number of cases actually reported. Now, we don't know to what extent that is due to an undercount or things happening at home and people dying at home. And we don't know to what extent that is due to temperature. In much of India, the temperature is high for most of the year, of course. And we don't know yet whether there is an important effect on COVID-19 of having a high temperature. We do know that countries in the southern hemisphere have experienced lower fatality rates thus far, because when COVID first broke out, it was wintertime here, and we've been experiencing it as we move through winter into the spring. And of course, the nations in the southern hemisphere, for example, Brazil, which only has a fraction of our fatalities, roughly a quarter of our fatalities, with 2/3 of our population. This may be due to the fact that a considerable part of their population lives in climate which is fairly tropical. It also could be due to undercount and to poor statistics. We don't know. But we do know that when we get to other states that have very, very warm temperatures, that the fatalities and the cases are far less. Here's an interesting comparison. 123,979 cases for Peru, right? And what is their population? Offhand, I'm not clear on that. Maybe 10 to 15 million, something like that. Ah, no, Peru has 32 million people. I didn't realize the population was so large, but nevertheless, compared to India, of course, it has a very minor population. And the population of India is roughly 40 times Peru's population. But a number of fatalities in India is supposedly almost the same, and the number of cases in India is comparable, 145,000 in India, 124,000 for Peru. We would expect that actually Peru might be better at counting, or maybe manipulating the statistics less. These numbers aren't really clear or very reliable, in my view. Canada has about 35 million the population. I haven't even checked it out. Uh, haven't actually checked it out, okay, in a couple of days, but let me go up a little higher. I went by Peru. There's Canada, 37.7 million. So 37.7 million, okay, very close to Peru. If you look at things, you'll see there's more cases in Peru than in Canada. That suggests that since Canada is probably one of the more accurate countries in counting cases, it probably means that the case count in Peru is not really too bad. Anyway, 6,545 fatalities in Canada, and in Peru, 3,629. Now we come to China, which is a very problematic case. The most populous country in the world, and they claim to have had only 82,985 cases. And of course, this is the country where COVID-19 broke out. In the first place, it's the nation which spread it to many other countries in the world. I should say from which it spread. I don't mean to imply it was deliberately spread by China at all. China was very vigorous in trying to shut it down. By all accounts, they were very successful, but it still seems to me that the fatalities are probably an undercount, and that the cases are probably, okay, an undercount, but maybe not. And I'll tell you why in a little while, why maybe not. But there are all kinds of reasons not to trust up front the China count. On the other hand, it's consistent with the narrative that China gives, and it's consistent with the performances, okay, of many, many other countries. An interesting case is Saudi Arabia. They claim 74,795 cases, but only 399 fatalities. Now, either they're grossly underestimating the fatalities, or they cannot track the fatalities because they can't find the people who have died. But if they find the cases, then you would think that they could find out whether the people who've had it have died. Maybe both are actually gross underestimates. We don't know, but the case fatality rate on official Chinese statistics is, well, you can see fairly low compared to some other nations. Roughly similar to Canada, but lower than Canada, based on number of cases. But the case fatality rate in Saudi is out of sight lower. And while the medical system, for those who are favored by the regime in Saudi, may be very good, I really doubt that their Medicare care system is better able to cope with viruses than Saudi is. On the other hand, the climate in Saudi is much hotter and drier. This may have something to do with the fairly low case fatality rate. You see, in Chile, there's a very low case fatality rate too. Now, Chile is a nation that's pretty sophisticated when it comes to data gathering and statistics. These may be real figures. You look at the case fatality rate in terms of known cases, it's down at 1%. Saudi's about 0.5% or something like that. Look at the recovery rates. I mean, Saudi claims 45,000 recovered cases. Is that recovery there? I think it is. Yeah, recovered cases. So basically, what Saudi is telling us, is they are telling us, hey, it's very mild, in our country. Out of the cases we know about, only 1% of the people have not fully recovered from the virus, and then we have another 384 people who are still recovering, who have serious cases, but are still alive. But if you look at Saudi, you're looking at a fairly warm climate. If you look at Chile, you're talking about a temperate climate, but one in the southern hemisphere. So you're in the summertime in Chile. In Mexico, you're talking about fairly warm climate in parts of the country, but parts of the country are temperate because the elevation, is high. And, so so it's a mixed bag there. Anyway, as you go through this list, you see, though, that low fatality rates sometimes seem to have something to do with what you can assume is not good reporting, at all. Other low fatality rates seem to have something to do with the geography of the situation. I haven't seen, any rigorous analyses yet which try to partial out the effects of climate so far on fatalities. All I'm doing is raising the possibility that some nations may have low fatality rates because they were in the southern hemisphere or they have a warm climate, okay, for the whole year, and that COVID-19 perhaps is slowed down by warm temperatures. Now, as far as I know, there are no definitive findings about that, but it looks like the statistics are starting to suggest that might have something to do with differences in number of deaths from nation to nation. But I want to get a little better picture of how nations are doing there by looking at the deaths per million, okay, in those nations. So let us do that. If you do it for the United States, you will find, in other words, if you divide 99,804 by 330 million, you will find that we have just gone over 300 deaths per million, okay, in our country. In Brazil, they do have substantial fatalities, but they're roughly operating right now at more than 120 fatalities per million. They may have had a more favorable climate situation. Maybe certain areas haven't started spiking yet. It might not be under control there. It might be under greater control here, okay, than there. I think they did start coping with it far later, okay, than we did. So they may be nowhere near actually flattening the curve yet, where we may be somewhat nearer when it comes to flattening the curve. In Russia, there have been 353,000 cases reported and many recovered. And of course, much of Russia is very cold and was in winter. And I think the medical care system has hemorrhaged since the Soviet period. So the number of deceased, that could be a vast undercount. I don't know. But it looks like let's actually find out. Uh, 36, 33. Divided by 145 million. Oops, sorry. 145 million. And we get about 25 fatalities per million. I say that's highly unlikely, but by how much are they distorting it? Oh, do they have a lot more cases? Are there cases comparable to our own? Well, they're a smaller country than Brazil. Brazil is reporting 375,000 cases. They're reporting 353,000 cases. It may very likely be the case that thus far their fatality rates are considerably lower, okay, than ours. Their recovery ratio, 197,000 over 26,000, is roughly, okay, at 8-1. Ours is more like 4-1. Oh, I'm sorry. I wasn't reading the recovery ratio. Actually, okay, of Russia. Their recovery ratio is astronomical, actually. Uh, it's like it's maybe 35 times their fatalities, and we're 4.6 times our fatalities. So if that were true, we would have to believe that their healthcare system is 8 times more effective than our healthcare system in handling COVID-19. I'm afraid I don't really believe that. I think there's an undercount in the number of deceased, the severe undercount. But who knows? Okay, I don't know for sure. But I want to bring us to some countries where the quality of statistics is probably a good deal better. The next 5 countries on the list: Spain, United Kingdom, Italy, France, okay, and Germany. Okay. Those nations are probably as good at counting, okay, as we are. You'll notice Spain was very hard hit, almost 27,000 fatalities out of that number, okay, of cases. But if you look at fatalities per million again, Spain has 46 million people. So we are looking at 26,387. If we divide by 46 to get the deaths per million, we get roughly 574 deaths per million. That is a very high figure, and you'll notice it's almost twice as high as the United States. When Western Europe actually became the epicenter of the virus, Spain did not move sufficiently fast to contain it. We can see that from these figures. When we move to the UK, okay, again, a nation that can count, okay, as well as we. Now, I believe this statistic here, that the number of actually recovered in the UK is set at 344. I think that's simply a mistake, that this site didn't read the statistics correctly, at least that particular statistic, because that is obviously far too low for the medical system of the UK. I mean, for God's sakes, you've got 1,559 serious cases that have not actually recovered. So this has got to be off by a considerable amount. But just let's look at the fatality rate. But per million, we get sorry, I lost my calculator again. I got to get it up there. 36,914 divided by Uh, as I recall, there are 66 million people in the UK. I think I'm right about that. Nearly the same as Spain at 559 per million. Pretty serious. And looks like Boris Johnson has done on that measure, has done about half as well, okay, as our authorities here. Not as bad as Spain, but pretty bad. Now, we were hearing that things were very bad, okay, in Italy. They were considered, okay, an epicenter for a while. And by the way, look at their recovery figures, which are probably more similar to the UK because they both have very good healthcare systems. Reportedly, they have maybe 4.5 times more recoveries than fatalities. Whereas, okay, in the UK, supposedly there are 10 times more fatalities than there are people who recovered, okay, from a disease. So that, okay, is not likely. But let me do the numbers here for Italy. 32, 877, 877 divided by, if I recall correctly, Italy's population right now is about 60 million. I'll double check this after I get the figure. That's 548 fatalities per million. Let me double check the population for Italy. You see, I wasn't far off of Spain. It's 46.7. I put it at 46. Italy, there's Italy at 60.461 million. Okay. So the figure I just gave in my calculator seems to be correct. So note France's population here. We'll be looking at that, okay, in a minute. 65 million. France, of course, has a very, very highly rated healthcare system, okay, in the world. It's a variant of a Medicare for all system and is rated very highly. I'm sorry, I'm pulling up the wrong application here. So here we go. What was my figure for Spain now? It was for France. It was 28,432. So 28,432. Sorry, I got that mixed up. 8,432 divided by 65, right? 437.4. Considerably better than Italy, the UK, and Spain, but still much worse than the performance of the United States so far when it comes to fatalities. Now, France reports only about twice as many recovered as fatalities, which does not speak as well for the system. Okay. In France, it may be they are discovering too few cases. It may be their system is actually doing better. I'm not sure what the situation is there. Maybe more people are staying home. They're not actually recording the deaths. I don't know. But here's a much more successful case. This K is Germany. Let's briefly check the population. I'm going to estimate it at 83 million. I'm a little off. It's closer to 84 million. So let's use the 84 figure in computing this. And we have, and Germany's very good at counting, as you know. They report 181,000 cases, roughly, and 8,428 fatalities. So let us do the calculation once more. $84.28. Germany has reported great success in handling COVID, but we'll see there are many other nations that are far more successful. What did I say the population was there? Closer to 84 million. So there we go, about 100 deaths per million. The performance from that point of view is 3 times better than the United States. And the ratio of the recovered to the deceased is also far better. I'm just going to get that ratio for you. It's 161 over 8 is a good approximation. So 20 times more people actually recovered from the virus as have died from it. In the United States, the ratio was 4.6. Okay, so anyway you slice it, Germany is doing hugely better. It's doing 3 times better in fatalities per million. And it's doing almost 5 times better in helping people to recover. With a climate that's not dissimilar from ours, perhaps a trifle colder. Okay. Somewhat colder, certainly a less varied climate, generally colder in Germany than it is here in the United States. So it should have been more fertile ground for COVID during the winter. So they did well. Now, how does that compare to Canada? I don't think we got the ratio for Canada, did we? But since we generally see Canada's healthcare system as very successful, let's do 65-45 over. Canada had what, 37.7 million. Let's call that 38 million. I'll do that again. That seems like it's too high. Seems like I made a mistake. 65-45 divided by 38. So that's right. 172 fatalities per million, far less than the United States, but nowhere near as good, okay, as Germany. So let's get some other perspectives on this. Okay, now, of course, we could take, let's assume for a minute that the Chinese figures are entirely accurate and they have not been playing with us, what would the fatality ratio be? Let's look at that. Let's see it. Number of deaths they report was 4634. And the population of China in millions is 1,438 millions. And the ratio we get is 3.22 deaths per million. That is very low. It's a very good performance. It is far from the lowest in the world. And the ratio of the recoveries to the fatalities is what it looks like. It's 18 or 19 or something like that. Comparable to Germany. But they actually had fewer cases than Germany because they controlled it better. So let's look at the southern hemisphere country of Chile. They're reporting 761 fatalities. Let's look at the population of Chile. Chile has 19 million people. So let's do the calculation. $761 over 19. $761 divided by 19. Southern Hemisphere country. We get 40 fatalities per million. Is that right? Yeah. 40 fatalities per million. Far better than Germany. Is it likely the Chilean medical system is better than the German medical system, which is one of the finest in the world, reputedly? No. It is not likely. Is it likely the Chileans are underestimating it? I doubt it. I think they're pretty good at counting. What could be the explanation? It could be climate. That it was the summertime. It has been the summertime in Chile. That could be the explanation. Okay. By the way, the worst country we've seen so far is Spain, but that's because we haven't looked at Belgium. There were 9,312 deaths in Belgium. Let's look at the population of Belgium. It's 11.6 million people. So let's do the calculation. $93.12 divided by 11.6. What do you get? Yes, 803 fatalities per million in Belgium. Now we know the Belgians can count very, very well, and they know they have a reportedly very, very good healthcare system there too. They did not act fast enough to contain this, in spite of their good healthcare system. And the result is, to date, 803 fatalities per million. Look at all those cases for little Belgium, 57,000 cases. Let's take a look at the Netherlands for a minute, because that will tend to validate what we found. Okay, for Belgium, 5,830 fatalities. Okay, and the Netherlands, I just passed it. It has 17 million people. So we're looking at 5830, 5830. 5830 divided by 17. 342.9, 343 fatalities per million. Substantial, right? Substantial. Okay, let's look at Sweden. Sweden has been taking a lot of criticism. In fact, I'm going to switch now to an article from Daily Kos. And this is by the Daily Kos staff, by Kos actually. And the title of it is Mass Death and Economic Devastation in Sweden, and conservatives want to be like this. I'm sorry, I got to share that one. I got to stop sharing this. And I have to share this one. So what do I do? Sorry. Didn't do a good job of sharing that. Okay. Mass death and economic devastation in Sweden, and conservatives want to be like them. So, Sweden has never had a lockdown. They've done some social distancing, but they've kept the restaurants open, and they've not seriously restricted the movements of people. They have done some things to try to restrict it, but they never did the lockdowns of other nations, of Europe. Okay. And here are the world's top 10 rankings per million population. Belgium was recorded at 795. I had a little higher figure because mine was as of today. Spain was 598. Italy was 537. The UK was 536. France was 432. Sweden was 389. The Netherlands was 338. Ireland was 321. The USA was at 292. We see now that it's gone up to 300 because we've had more deaths. Switzerland is at 220. Now, Koss says most countries on that list have gotten the pandemic under control. Even Italy has begun to open up, except two. The United States, and we have now begun to open up. Sorry, this has been scrolling too fast. Anyway, Sweden, though it compares well to other nations of Europe that have had their shutdowns and have bent the curve, and Koss actually opines that we in the U.S. should be exceeding 500 deaths per million before the end of this year, unless conservatives finally decide to take the pandemic seriously. But he claims most countries on the list have gotten the pandemic under control, except two, the United States and Sweden. And he says, and the UK isn't great either. And he said, expect these three countries to keep on moving up this chart. In fact, Sweden is likely to surpass France for the number 5 slot by the end, of next week. The U.S. should exceed 500 deaths per million before the end of this year. But he wanted to make the comparison of Sweden to their neighbors. In other words, the other Nordic countries whose climates are somewhat similar to Sweden, who are going through the winter, who had similar healthcare systems and welfare state systems. And of course, the comparison is rather stark. Sweden has had then 389 deaths per 1 million population. Denmark had 97 deaths per 1 million population. Finland had 55 deaths per million. Norway had only 43 deaths. Iceland had only 29 deaths per million. Of course, none of these countries were near China, but for the time being, we're doubting the statistics in China. How much did China have? Was it 6 deaths per million in the end? Something like that. It was very small. So these other countries had their shutdowns and bent their curves. They acted very vigorously to restrict, to properly social distance, to stop people from going to public places. Sweden thought it would be different. It could be more lenient, and it thought this because, one, the healthcare system is extremely good, but two, 50% of the Swedes are living alone in apartments or houses. So it was felt that they won't be coming into contact with other people who would be bringing things in from the outside. Well, maybe since they were living alone, they went out more to see other people, and so they themselves were bringing it in from outside rather than their partners. So maybe the fact that 50% of them, were living alone did not serve to restrict transmissions of illness as much as the Swedes thought going to be the case. But in this convincing comparison, the big and only difference was that Sweden pretended nothing had changed. I think that's a little unjust to Sweden. They did a few things, but they were running the philosophy that they might quickly lead to herd immunity and minimal impact on the economy of the country. Well, the point of this article, of course, is to point out that Sweden got nowhere near that only 7.3% of people in Stockholm had actually developed the antibodies needed to fight the disease by late April. And Koss says it's pretty much the same level of antibodies found in other countries that had lockdowns. In the U.S., for example, it's estimated that 5 to 15% of Americans now are immune. Okay. So the Swedes are very far below the 70% that you need to get to where they want to go. So the punchline of Koss's article is that Sweden's economy is projected to suffer the most out of the entire European bloc this year. So keeping stuff open didn't even save its economy. It's made things worse. And then Koss takes a poke at Tucker Carlson and the National Review and Rand Paul, because they keep talking about following the Swedish model. But as of now, the Swedish model has produced more fatalities per million than our rather terrible model here in the United States. And they're expected to have the worst in Europe performance with respect to their economic system. And Koss accuses them of embracing death as a guiding principle. And then Koss refers to the likely deaths that we are facing here. We may well be facing those deaths. I don't know. It depends upon how the reopening occurs in various states. But the idea of reopening the churches for physical meetings seems like something that really tempts the fates, just as they tempted the fates in Sweden. But I don't think that Sweden allowed the churches to keep running in the same way they were. So I think that was one of the things that Sweden did to actually try to limit things. But anyway, that's a separate question. I haven't gotten to the really shocking things yet. Okay, I really haven't. I'm now going to go to the more shocking things, but I want you to keep in mind how poorly Sweden has done compared to the other nations directly comparable to it. And that other nations in Europe have done much better than Sweden, but that other nations have also done worse, like the UK and Italy and Spain. And also Belgium, much, much worse. So there are countries in Europe that have done worse than Sweden and that have had shutdowns. On the other hand, those countries claim now to have bent the curve. And then, of course, there's also the fact that Sweden has not done well compared to the most directly comparable countries to Sweden. And we've been over that. But now let's get a little more into the comparison of statistics. Let's go to countries that have done thus far extremely well. I won't go to Qatar because I don't have faith in the counting system there. I don't know anything about it, and I just don't have any faith in it. I do in Sweden, of course. I have a lot of faith. Now, I think Singapore probably counts very well. It's a very prosperous country. It's been a very successful model, okay, of economic development. I doubt that they're cooking their books. They also have a high density, okay, population there just for the. On the other hand, they're quite warm there, quite warm. So their success may be due to it might be due to a combination of temperature and a very good healthcare system, which they have. Let me see if I can get to their population. I think it's probably down here, but I'm not certain, and we will see. There it is. 5.8 million people. Let's round it off at 5.9. It's a hair closer to 5.9 million. So let's look. There were what again? 23 fatalities. So New York City would give its right arm for only 23 fatalities, right? So we have 23 fatalities divided by 5.9 divided by 5.9. And we have 3.9, let's call it 4 fatalities per million in Singapore. An enormously successful model. We know they tested vigorously. We know they contact traced. We know they isolated vigorously. They're an example of how well you can control COVID-19 if you're willing to make the effort, if you're willing to contact trace, if you're willing to test, if you're willing to isolate, if you're willing to quarantine people when they get it. Okay. Let's go to also Singapore. We have to note that Singapore had a good many cases. And we're talking about a discovery of its cases. They had only 5.8 million people. They discovered 32,000 cases. Okay, now Sweden has 10.9 million people, and they discovered 33,000 cases there. So Singapore did a better job, twice as good a job, of discovering cases. So they discovered cases, they cured people, they had a ridiculously high recovery ratio to number of fatalities. They had very few serious cases there. I infer some of that must have to do with the climate and the warmth there. I'd be surprised if it did not have a lot to do with that. But on the other hand, it probably has a lot to do with a great healthcare system, which I believe is largely free, and with the testing, the contact tracing, and the quarantining of people, the policies. Okay, let's look at some other nations that we know can count. Now, Japan has fairly temperate weather. They can count. They discovered 16,581 cases. They have 830 fatalities. They have 13,612 cases, okay, that are recovered. So they have a recovery ratio approaching 15-1, which, okay, is very good. Their fatalities per million for a country we know has extremely good health care and a very high life expectancy. We are looking at here we're looking at 830 fatalities over Japanese population is about 124 million. We're looking at about 7 fatalities per million. Not as good as Singapore. Not too different from China, though, right? Not too different from what was reported by China. In the same ballpark. I think China did a little bit better. I'd have to compute that again. I've forgotten what it was. When I have time, I'm going to do a spreadsheet of this so that it's easier to go through these things. Now, Argentina, which can also count, has reported only 467 fatalities and a recovery ratio of about 8-1. About 12,628 cases. They're also another Southern Hemisphere country that's been going through summer, which might have a lot to do with why they've done so well. But let's do a computation here. They have 467. And what's the population? If I recall correctly, it's about 40 million. I'm sorry, I think it's 43 million. It's very close to Spain's population. That's about 11 fatalities per million. Here in the United States, of course, we would kill to have 11 fatalities per million. I don't know what policies Argentina has been following. I don't know what parts of Argentina have been shut down. I don't know what they've been doing. They have a pretty good healthcare system. Yeah, I know that. I think the big factor might have been their healthcare system combined with the temperature slowing down the spread of COVID. Okay, now much of Argentina is temperate, of course, but at the same time, it's been summer down there. So we have to consider that. But I want to get to some really good cases because my time's fleeting here, and I'm going to have to go to discussions soon. But let's look at South Korea. There were 267 fatalities there. Now, that's an outstanding case of testing, contact tracing, and quarantining people. A very vigorous case in a relatively democratic country with a very good healthcare system. Now look at this. Oh, by the way, temperate climate there. South Korea, some of South Korea is fairly cold, okay, in winter, if you recall. They recovered 10,226, which is what, 50 times more than the fatalities. Very, very good as a recovery rate. What's the population of South Korea? 51 million people. South Korea has more people than Spain. So let's look at the number. We have 267 divided by 51. The deaths per million is lower than Japan. It's 5.2. It has an appreciable population. It's generally viewed as a capitalist country, not particularly socialist. There's a lot of inequality there. But they managed to keep their fatality rates down to 5.2 per million. And they're beginning to move into their summer. And they seem to have COVID-19 under control. They're not getting many new cases. They have flattened the curve. They have pounded it flat. It can be done. Can be done in a country which is largely democratic, willing to make the effort without killing the economy of that country, as far as I know. But they shut down what they had to shut down. They shut it down quickly. They focused on the individual cases. They did the right things, and they succeeded. There's no question they succeeded. Let's look at the Czech Republic. They had 317 cases. I'm sorry, 317 fatalities out of 9,000 cases. They recovered 6,182 people, a ratio of maybe 20 to 1. We know there's a very good healthcare system in Czechoslovakia. I'm sorry, in the Czech Republic or in Czechia. And we know that they have done very well in curing people. Their population is 8 or 9 million. $10.7 million. So 317. And by the way, it was cold there during the winter. Usually is. What did I say? 10.9 million. $29 fatalities per million. Let me double check that. I'm sorry, 10.7 million. So it was probably at 33 fatalities per million. I'm not going to do the division again. So they didn't do as well as South Korea. They didn't do as well as Japan. But they've done considerably better than Germany. Is that a surprise to you? They've done considerably better than Germany. And far better than Sweden. Testing, contact tracing, isolating, having a very excellent healthcare system. All of these things were effective. Okay, Australia. They've been very vigorous there in testing, contact tracing, okay, and isolating. I don't think they've done very much shutting down there. They have a Medicare for All system there. And they have about uh, 25.5 million people there. So we get they are a southern hemisphere country, though. It's been summer. 102 over 25.5. They're just going into their winter. Maybe they'll have a tougher time now. Maybe not, because they may already have controlled it. But here we are, 4 fatalities per million in Australia. And believe me, the Australians know how to count. Well, I'm running out of time, so I'm going to stop this soon. But okay, I think you're getting the picture. I think temperature has an effect on this. I think the healthcare system that you have has an effect on this. I think the vigor with which you shut down when you have to shut down has had an effect on this. And I think the testing, the contact tracing, and the isolating has had a tremendous effect on the fatalities. I won't go through Thailand, which is a rather outstanding case, actually, because I don't trust their numbers or their ability to count. I think there are just a lot of undiscovered cases there, and there may be a lot of fatalities there. But, of course, it's been very warm there. So maybe not. In other words, a lot of this may have to do with the temperature there. Okay, I'm looking for a few outstanding cases right now. A place where the temperature is always warm and where the healthcare system is very, very good is our friends in Cuba. So, how many of our Cuban friends actually exist in the world? Well, what do you know? There are 11.3 million Cubans. 11.3 million Cubans. So let's go to the calculator again. And we had 82 fatalities. And 1,704 recoveries, only 1,947 cases, and we have 11.6 million people. And we have, again, among the lowest in the world at 7 fatalities per million, right in our hemisphere. Of course, that might have something to do with the fact that the climate is very warm there, but also they have a great healthcare system, and they were probably testing and contact tracing and isolating a hell of a lot more than the United States was. There are reports from Cuba that testers go around there multiple times every few weeks, actually, and test people to see if they have it. I just want to check out a few more places for you. There's New Zealand with 21 cases and 4.4 million people. I'm sorry, 21 fatalities, not cases, of course. 21 fatalities divided by 4.4 million people. That's 4.7 fatalities per million. Also one of the lowest in the world, right? A very successful country, very vigorous in contact tracing, in testing, in isolating, and in shutting down when places needed to be shut down. They did a wonderful job of containing it. They stopped people from coming in. They just stopped people from coming in. And they did a great job. Hong Kong reports only 4 fatalities over 1030 cases. That could be true, and I'll tell you why it could be true in just a minute. I'll show you why. Okay, it could be true, but I'm not going to assume that it's true, because I'm not going to assume that their statistics are not cooked, because I don't know how much control China has over those particular statistics. Hong Kong has very, very high density, of course. But I do want to go to one other country before I end this little survey. And that country is Taiwan, which has a warm climate, but not a tropical climate. Taiwan has only, it's actually reported 441 cases. It has had 7 fatalities. It has recovered 415 people. It has no serious cases right now. What the hell is going on there? Extremely vigorous testing, contact tracing, isolating, keeping people quarantined when they come in. Very, very vigorous response. Very good healthcare system based on the Medicare system here in the United States, but extended for all, with little or no copays or deductibles. 100% of the population, roughly, is covered by the healthcare system. How many people do you suppose Taiwan has? Let's just check that out before we do the computation. 23.8 million people. So let's do the computation. And this will be the last one, I promise. Seven. 23.8. 0.29 fatalities per million. What if the United States had that rate of fatalities per million? How many fatalities would we have had? I'm going to multiply that by our 330 million people. We would have had only 97 fatalities. Instead, we've had 1,000 times more fatalities. 1,000 times more fatalities because we did not move in the vigorous way that Taiwan moved. We could have saved most of the nearly 100,000 people who have died here. That's how many we could have saved. And that's what real success actually looks like. Now, why did I say that Hong Kong might just be true? Because if you look at the population of Hong Kong, it isn't 24 million. The population of Hong Kong is 7.5 million. So the fatalities per million of Hong Kong are actually, they're still a fraction of one, but they're somewhat larger maybe twice that or 3 times the figure per million of Taiwan. Now, Hong Kong has a pretty good healthcare system too. And they have a similar climate to Hong Kong. And maybe they vigorously traced and contact traced and tested and isolated as well, because they might have known they were in great danger too. And maybe they had enough control as well to control things. Even though I don't trust their statistics, I'm going to say that if Taiwan could do it, and I know Taiwan knows how to count, I'm pretty sure they know how to count in Hong Kong too. The Taiwan success suggests that Hong Kong was not lying. It maybe even suggests that maybe China wasn't lying too much in relation to its overall success. Because Hong Kong got down to less than one as well. Less than one fatality per million. How many people in Hong Kong are weeping over COVID-19 losses? Well, just a few more people per million, just a little greater fraction of a million than in Taiwan. But right now, those are the two most successful cases in the world that I know about. And neither case is both of those cases are known for having very vigorous systems of capitalism. South Korea was also extremely vigorous. Australia. A lot of the very successful cases are in the northern hemisphere. So you don't have to be in the southern hemisphere to be successful. But we know now where the successful cases are. We know what the people have done. We know where the problematic cases are. We can measure the failure, okay, of our government. We can measure the failure, okay, of our government. Sorry, I never quite stopped sharing that one. Okay, to go back to the COVID. So, I haven't formalized this yet. I just haven't had the time. Okay, but in terms of sheer performance in containing the virus, our performance in the United States is crap, all in all. And if you take into account the fact that we've not really bent our curve completely yet, we're among the worst in the world, by far among the worst in the world. There are countries that have done worse thus far, but whose future outlook is better than ours, because they seem to have bent their curves more than we have bent ours after starts that were a lot more severe. We also know that from the standpoint of economic damage, that we have done perhaps the worst in the world right now. We are facing a depression unprecedented in this country because we created the worst of all possible worlds here. And who created the worst of all possible worlds? The lion's share of the blame has to go to the administration. I don't see how one can possibly avoid that. I don't see how you can avoid that particular conclusion. Unemployment rates approaching 25% and maybe even reaching 30%. A crashed economy. 300 deaths per million. Projected by some to rise to 500 deaths per million, compared to some countries, okay, the good performing countries that have figures like 0.29, 0.6 tenths of a person per million, maybe 4 deaths per million, 6 deaths per million, 7 deaths per million. Extremely low percentages, not in 1 or 2 countries, but in multiple countries. I must have gone through 15 countries that have statistics where the deaths per million are what, 10 to 20 to 30, and a couple of countries that are a fraction of a million. Countries in the northern hemisphere, countries that have yet to go through their summer, countries that can count. Taiwan can count. Hong Kong can count. I didn't want to count Hong Kong at first because I thought that they might have been cheating just a little. But we know Taiwan isn't cheating. And we know that Hong Kong and Taiwan have similar cultures in many ways. And very good healthcare systems in both places. And we know they may well have done what was necessary to cope with this virus in spades. And we also know that we failed at that. We utterly failed. In spite of our supposed greater scientific capability, our supposed greater technical capability, we failed. And the failure has to be put on our leadership and has to be put on our government. We have to have the courage to lay most of those 100,000 deaths at the feet of where they belong. And it is at the feet of both our federal and many, many, many of our state governments, including the New York State government, including the government of our big cities, like New York City. They just did not do what they had to do for us. They just didn't do it. That's all there is to it. They didn't do it. They failed. I'll selectively read some comments. Number 3 daughter was in downtown Frederick, and she said almost nobody was wearing masks. There you go. Nobody was wearing masks. What do they do in Taiwan? You really think nobody is wearing masks in Taiwan? How about Hong Kong? You think nobody's wearing masks in Hong Kong? How about China? You think nobody's wearing masks in China? I got news for you. They're wearing masks in all those places. And Kate says, a friend from Southeast North Carolina, where I used to live, posted pics of one of the beaches there, and it was packed. Yeah, I know. They're really out at the beach. I'm sure the beaches are fine if you practice social distancing, but if you're packed, you're crazy. Stephanie says, 88 grooves before they stopped me for the night. Thank you, Stephanie. That's wonderful. Was it Facebook that stopped you? Evelina says it will become increasingly difficult to keep people inside with better weather, but would help if authorities inform the public better in underlining the risks, stressing the risks. I don't think the authorities are going to do that. Trump has chosen his course. He seems incapable of changing that course, because he is unmoved by death. He is unmoved by death. Stephanie said, still PM, folks. Hopefully that helps. I'll bet it will, Stephanie. Kay says, the governor of North Carolina is a Dem now, but the state house is still GOP. He's done a fairly good job, but it is now tourist season all over the coasts. And by the way, as I understand it, they've undermined his power. Okay, I think the legislature has put certain controls on him. So when you say governor of North Carolina, it's not like saying governor of New York State or governor of New Jersey. Evelina points out the UK is up there. Don't know that Spain is worse. Spain per million is worse. It is. And John Termel says, must shake hands to break the spell of Fauci false alarm. I'll shake yours if you'll shake mine. I'm not shaking your hand, John. I have no idea where you've been. I don't know what you mean by Fauci false alarm. I think Fauci has been fairly cautious all along the way. As cautious as he could possibly be, given that he's in Trump's federal government. Kay says, I finally found some nature-made vitamin 3 today, so I will start taking them tomorrow. Great. Vitamin D3. Start taking them. Take 5,000 to 6,000 units a day. Evelina says, interesting that Peru is up there given the scarcity of information coming out of there, virtually zilch, and the reason I can tell you. Yeah, I'm not sure about the Peru statistics, not sure at all about the statistics. Kay says, what about Portugal? Portugal has substantial deaths, okay, as well. I think the population of Portugal, okay, is about 11 million. The fatalities in Portugal, let's see, Pakistan, Belarus. The fatalities in Portugal were 1,330. So Portugal seems to have done better than Spain. Well, they have 1,330. Divided by 11. I think 11 is a pretty good estimate of the population. About 120 people but per million. Not quite as good as Germany, but in that kind of ballpark. Nowhere near Spain. Nowhere near Spain. But they did better than Spain. They certainly did better than Spain. And many of the other European countries. Stephanie says, anyone here think we will see another bad outbreak with the economy opening prematurely? I think there will be. I think it's premature too. And I think we're going to experience some other bad outbreaks. But there's one thing going for us which we haven't really credited so far because we haven't fully established yet the precise effect of higher heat. Evelyn asks, will the further outbreak be covered up the more November approaches? Perhaps. I expect there are going to be efforts to do that. Whether they'll be successful or not, I don't know. Stephanie said, I'm going to pretend the economy is still on lockdown through the rest of May, maybe halfway through June. It may be longer than that because people may refuse either to go back to work or to do much in public. I mean, people are and should well be cautious. Stephanie says Arkansas has 107 deaths so far. Virginia has, I believe, many more deaths than that. We are a hotspot actually right now. Let me go back there. I can get back there pretty quickly. It's Virginia. $1,208 in Virginia. Close to 38,000 cases, reported. Actually, Louisiana has a similar number of cases, but much less in fatalities here in this state. There are more poor people. Now, Louisiana has more poor people. And I think their healthcare system is much worse than Virginia's healthcare system is. I think the governors are much better here also. Yeah, 1,208. We are, the order of the states here right now is New York leads substantially in fatalities, 29,310. Then there's New Jersey, which is 11,155. And you can be sure New Jersey is leading because there's a spillover effect from New York. Okay, but it's that particular spillover effect. And from Philadelphia. And Illinois is 4,884. They're in third, but they're way behind both New Jersey and New York, which have much higher deaths per million. If you want to look at deaths per million, New York has 29,310 deaths, and that's divided by 19 million. So if I'm correct, well, I'm not going to divide it. Okay, I'll leave it to you to divide, but I think it's over 1,000 deaths per million. Somewhere over 1,000 deaths per million. It's horrendous. And New York has been a slaughterhouse. And a lot of it has to be blamed on the governor and the mayor of New York City. Both of them have done a horrible job. Of course, there's some blame to go around in relation to the federal government. But we know that. Then there's Illinois, then there's California with 3,809. Much safer to be in California than New York right now. Massachusetts, the fatalities were greater, but the cases were less. 6,416 fatalities. Then comes Pennsylvania, a number of cases, 5,178 fatalities. Actually, California has less fatalities than these other comparable states, only 3,809. Texas, which is a huge state, right now, it's 29.9 million people, has only 1,542 fatalities and 56,693 cases. Now, Texas, of course, is warmer than a good many of the other states, except for California. California has a greater population than Texas, but it's only about a third greater. So Okay, it's a third grader, but it has about 2.5 times the fatalities of Texas. I suspect the California healthcare system is probably better than the Texas healthcare system, but maybe the population density of Texas is less than California. I don't know about the conditions there, but I'd say simply looking at the situation, that Texas, off the top of my head, has done better than California. There are better outcomes in Texas, okay, right at this point. Michigan, lots of fatalities, okay, in Michigan. Okay, I think that Gretchen Whitmer had to put it into lockdown, had to bend that curve because those fatalities were much too high. And Michigan has only half the size, okay, of New York or New Jersey. It's in population. I mean, its fatalities would be comparable to New Jersey if it were the same size. Florida, 2252. So we can go down these states. Anyway, that's what's going on inside of the United States with respect to a lot of the states. We also have an asshat for a governor who's a Trump supporter, hardcore, and Tom Cotton is a senator. Yeah. Stephanie says, "Hey, Misty, miss you, stranger." Stephanie says, "Thank you, everyone, for watching." Indeed, thank everyone. Thank you, everyone, for watching. As for tomorrow, I expect the death toll in Minnesota to be 900 and the U.S. to be 100K. Me too. It's going to be over 100K. It's 99,805 now. So by the morning, it's going to be close to 101,000. Evelina says Socialist Coalition governing in Spain, Tory government in the UK. Well, Minnesota seems to be doing better than Virginia. I think that Minnesota's population is higher than Virginia off the top of my head, and the fatalities appear to be lower. Right. I think being a socialist or not being a socialist has something to do with it, but of course, the Tory government in the UK still has the National Health Service, and I don't know if the healthcare system, how well the healthcare system in Spain compares to the National Health Service. All these governors on lawful order is find people to have to stay at home, telling them and have to wear face masks, or tell people they can't go to the beach. None of these are against the law of any government official to American people's treason play that you give me. Look, but Daniel, 100,000 Americans have died already. Those deaths could have been prevented. I think I've proven that already just in going over these particular statistics. Nations far less technologically and organizationally capable than we have minuscule fatalities. So what you're saying is a bunch of crap. These things are not unconstitutional, except in your opinion, which is frankly screwy. Stacy, is English a second language for you? Does assholism just come naturally? Yes, good. STFU. Stacy. Stacy, be polite. Evelina Pont says Pinera is a liar. Evelina says, no way, Chile is better off. They don't even have public health systems to speak of, mostly privatized. Well, how's the health care system in Chile? Can people easily get health care? Have they got a system that works, whether it's privatized or not? I mean, it's privatized in Germany too, but they have a very good healthcare system. Anyway, Chile doesn't compare to Taiwan. And Steve points out these 24 states have uncontrolled coronavirus outbreaks, the study says. So there it is. We're going to have outbreaks. Stacy said Iceland tested everybody, and Iceland has very good figures. Stephanie says Stacy Van Veen, assholism, nice word. And yeah, the CDC has been conflating the positive tests with the antibody tests. And Kay says all the tests in this country are questionable as far as being accurate. Yeah, as well as being too few that haven't been accurate. My daughter in Florida had symptoms and went to the doctor who tested her, and the test came back negative, but a few days later she was in the hospital with almost a stroke. She's only 35, and that is what happens to people her age many times. Why is that, Kay? Kay Clark Ryan, oh my God, that's so scary. I'm so sorry. Not sure why that is, but that is what happens. Restricted blood flows to the heart and brain in younger people. That is true. Evelina says, why strokes? I hope she's better. And Kay says, Stephanie, she is okay now and back to work. Last I heard from her, and I have tried to teach her about vitamin E for blood circulation. I hope she listens. Yeah, vitamin E does seem to guard against COVID. I think you can still get COVID, but at the same time, it's supposed to be far less severe if you're taking the required amounts, of vitamin E. Evelina says Argentina has developed their own COVID-19 test, which I assume is effective. And Rick Maynard says Chomsky on COVID-19, the latest, the massive failure, of neoliberalism certainly is a massive failure. Stephanie says, thank you, Rick Maynard. I'll check that out. Yes, thank you, Rick Maynard. I'll check that out too. And Kay says, I heard that Cuba has a good, accurate test too. I think Kay meant to say test. Yes, I think they do. Yeah, Cuba's medical prowess is awesome. It's just awesome. Stephanie says Arkansas is acting like it's all over. That's ridiculous. Well, remember, it's going to get warm soon in Arkansas. We may get a break for 2 or 3 months, especially in the southern states. And Rick says, a woman hailed as a hero after giving a motorcade of Donald Trump the middle finger. Yeah, I remember that. The middle finger, yeah. Ohio may be going that way too, Stephanie. The state house idiots are overruling the governor here lately. Yeah, and it's a Republican governor too. Stephanie says that's perfect. Rick says it appears that temperature and humidity can allow the virus to thrive and factor in healthcare, and density, and factor in whether the country has shut down and whether it's contact tracing, whether it's isolating. Other countries can afford enough tests, to repeatedly test their citizens. We can't provide enough tests for everyone living here, the richest country in the world. It's embarrassing. It's worse than that. It's criminal. It's disgraceful. That's right. The UN did a report on poor folks' living conditions in this country, and many live in third world conditions. They do. State says all this higher math, I don't have enough places on my abacus. Hey, it's just multiplication and division. Stacy Van Veen, I seriously don't do math well, for real. Laugh out loud. I haven't done any math tonight. I've only done arithmetic, folks. Only arithmetic. No math. I haven't scared you with any math. I haven't even done any linear equations, any simple linear equations. Russ says, I need to turn in. See you again soon. Thank you for coming, Russ. Kay says, my granddaughter and great-grands live just above the Detroit area. I worry a lot, but Chelsea seems to have it handled, at least so far. Is your granddaughter's name Chelsea? And Dolores says, I heard the same about cannabis. Kay says, my dad had a stroke when I was young, and his doctor prescribed vitamin E. Went to Canada to a vitamin E clinic to learn about it all back then. That was when we actually had health care instead of sick care. Yes. Okay. I think I've done it. I managed to get through all your comments. Thank you for the sharing. And by the way, share, like, and subscribe. And I should certainly be reminding you of my banner here. My YouTube channel, please share, like, and subscribe when it goes up in YouTube. And remember my Patreon link. It's at Joe Firestone. It's at patreon.com /Joe_Firestone. Please remember that. And there's one more comment, I think. Yes, Chelsea is a great young woman. I hope she was named after Chelsea Morning, Kay, and not after Chelsea Clinton. Anyway, good night. Thank you for coming, and thank you for staying. And I'll end now.